afternoon, ladies and gentlemen. Let me introduce myself. My name is Kurniati Puji Lestari from Nursing Department of Health Polytechnic Semarang. Here I would like to present my research study with the title Baby Masses Increases Infants' Body Weight in a Primary Healthcare Services. There was 5 presentation outline. First, introduction. Second, method. Third, result. Fourth, discussion, and 5, conclusion. Introduction. LBW or low birth weight infant is a condition in which babies are born with less than 2,500 grams. According to the WHO, 2018, as many as 15.5% of cases occur in developing countries, including Indonesia. And according to the Central Java Health Office, as many as 6.2% of total cases in Indonesia. And according to the Semarang City Health Office, is 506 cases, or it is 2.02%. And the writer have done study cases in 3 primary healthcare services. There are Padang Sari, we got 3.7%, Budak Payung, we got 5.7%, and Strondol, we got 4.6%. Maternal LBW caused by maternal factor, educational background, age, pregnancy, distance, antenatal care, chronic disease. And the impact of LBW is morbidity, mortality, infants' growth and development delay. Recent intervention that government have done is 1,000 first day of life, consists of provision supplementary food, milk, iron tablets, antenatal care, monitoring maternal pregnancies. And the solution of the LBW is baby masses can stimulate infants to feel hungry and accelerate the process. And it can increase body weight and growth, concentration, and quality of sleep. The aims of this research is to identify the influence of baby masses on infants' body weight. Method that we use is with the design quasi-experimental pre-post test with control group, and the population is 32 infants that we divide to 2 groups is 16 infant in control group and 16 infant in intervention group. Inclusion criteria: 1 is low birth weight history, age 1 to 6 months, receive exclusive breastfeeding, maternal BMI in normal range. Data collection that we have is intervention baby masses was given twice a week for 10 until 15 minutes in the afternoon before the baby saw. Instrument that we use is infant's weight observation sheet with manual baby weight scale. Time and location. This research have done in January until February 2020 in Padang Sari, Budak Payung, and Strondol primary healthcare services. And data analysis that we use is independent test. And this research have ethical clearance from Health Polytechnic Ministry Semarang. Result. In this result we divide to 4 tabel. Tabel 1 is explain about the characteristic based on age, maternal age at birth, and birth weight. Tabel 2 explain about infant characteristic based on sex. Tabel 3 a description of baby weight, and Tabel 4 explain about the effect of baby masses on infant's weight. Discussion. The most of the babies are male. There was difference in development. Male babies tend to be more active in movement than female babies. The age of maternal pregnancy was 37 weeks, so include in preterm infant. The week less than supposed to be for gestation. This caused by uterus inability to hold the uterus. Disturbance during pregnancy, the release of the placenta earlier than the time. The babies age 1 to 6 months, so included in the age category of mandatory exclusive breastfeeding. Exclusive breastfeeding is very important in the growing period of the baby because the first 1,000 days of life determine the growth and development status of an individual when he is an adult. According to the research from Rosli, Firdha and Maya, Betes and Suryani, the average baby weight of babies is 2,300 grams. Body weight is used to determine a normal baby or LBW. After the baby masses, the increase in average body weight that occur in 200 grams after baby masses twice a week for 2 weeks. And baby masses can increase beta endorphin, which affect the growth mechanism. Besides that, it also increases the tone of the vagus nervus, which affect the absorption mechanism of breast milk so that the baby will quickly hungry and breastfeeding more frequently on the mother, which also result in increased milk production. Next is conclusion. One, there was an effect of baby massage on the significant increase in infant weight. Baby massage as a form of stimulus to the baby and increasing the bonding between mother and child can stimulate the growth and development of the baby. 3. Baby massage intervention can be integrated with maternal and child health programs in healthcare facilities through family empowerment. 4. It is necessary to have standard operating procedures so it can minimize error in applying baby massage. And the last is the result of the study can also be used as a basis for identifying other interventions that are more effective in increasing infants' weight. Besides that, other variables that can be increased through infant massage such as body length, height, nutritional status, sleep quality, and so on. There are some references that we use, and okay, I think it's enough for my presentation. I'm sorry if there are some mistakes. Thank you for your attention. Good afternoon.